I think, you think about coming over, the first thing that comes to your mind is, oh, we need to get treatments right. We want to make sure the treatment is okay. And then you think, oh, okay, we need to get, the visa. I mean, those are kind of the big concerns you have. It never really occurs to you that you don't know how any of this work. You don't know how the system works. I mean, in Elsa's case, we had to go through the dentist, to get the dentures done. We had to get the diabetics sorted out. We had to get the eye and the hotel, of course. And
because you have spent like almost 3 weeks here.
no, absolutely, because then not only do you need to actually find the best place to actually get the treatment, but you also need to organize the time. You need to make sure the doctors are okay with your dentist appointment. When do you get a checkup? When do you need to kind of sort of do the pre-surgery consultation, blood test? I don't think there is any way we can actually do it if you didn't help us.
Especially that some of those were unexpected, so we've been scheduling.
It is.
Them
There was
like
lots of last minute kind of sort of additions because initially we came for a surgery replacement, hip replacement. So we thought, get the hip replacement and it's done. And we thought, oh yeah, the diabetics, how do we do that? And maybe we should get the prescriptions done. And then we thought, oh, why don't we just get the eye done? And we just kept adding on this new kind of sort of requirement, which meant the whole thing would have been completely impossible for us to do. And then you think of like, where do we get a place in terms of staying? I thinking of hotel. Do we get for 3 beds, and then 3 beds just for the first couple of days, and then you have to go and kind of sort of do that 2 people staying, in the hotel, and then have to rebook back again. I don't know if I would have done it even if it was in London. I mean, even I lived in London, I don't think it would have been that easier. You need somebody who can give you that full attention and dedication to make sure that you do have that, the staff coordinated. And I think he spoke to Michael on a daily basis on that. So you need that level of commitment to make this work.
Yeah. So you were a little bit anxious before coming here, or?
Well, I've never been to Poland. I mean, the whole thing is anxious kind of sort of the field is. My mom is not feeling well. You think, she's gonna be okay. It's not gonna be the best of time when you go to surgery, especially something as major as hip replacement. So you have that in one mind. And second mind, because I'm a software developer, I'm a programmer, do I have time? Do I have the internet connection? Am I going to go to the right place? And then, and then you think, is the place going to be okay? Are the people going to be okay? Like, is it going to be okay? So I've never been to Poland. So you have these, background anxieties, and you're not sure how to handle them.
What was the time you felt better here, or you had this in mind that everything is going to be all right, I'm in good hands? What was it? When was it?
We felt, I mean, I said that to you the first day we walked in. We felt pretty much comfortable as soon as we came in. The taxi came, picked Elsa up, took her to the hotel. Then we met you, and then you organized everything. The next day, 7 o'clock, the blood, going to the dentist, and you had everything figured out. Turn up on time. Like you said, I'm gonna be there at 7:45. You're on the for 7:45. Or I'm gonna be 1 minute late, and it's really nice. Like at least you know where it's going. 1 minute late, means something. So you actually, when you communicate that, it's absolutely amazing. So I think from the logistics side, and whether we're gonna go somewhere that is going to be adequate for us, that kind of felt comfortable very quick.
Perfect.
The next thing was, how do we fit in? Can we communicate? Can we, are we going to understand what they say to us or what we say to them? I mean, the consultant, the surgeon, Dr. Matthews, is absolutely amazing. I mean, he was super cool, very calm, spoke to Mum quite nicely, made her feel quite comfortable. He wasn't your, I've got this big white, coat and I'm going to talk to you seriously, that you feel nervous. He was very relaxed, and that made her relaxed. And I think she has the white coat syndrome.
Yeah, and also Elsa had a really nice relationship with this physiotherapist, because they also had
so once we had the surgery done, then you have the kind of sort of the aftercare team, coming up after surgery, the care team, the nurses. They were superb. They were so nice.
And would you recommend this prolonged stay? Because some of our patients, they mentioned that I don't want to come for longer than 1 week because I need to take some more time off. But we try to convince them that it's really vital to get this physiotherapy together in the package. What is your opinion?
I like the honesty in the service that was offered. You don't feel like somebody's trying to get you to stay as much as possible.
Mm-hmm.
It felt like you're gonna stay if you need it, kind of thing. And if we, I mean,
Mm-hmm.
we did the last day, we did come and say, oh, maybe we should stay a few more days.
Mm-hmm.
The doctor said, I don't see that, any real medical reason
Mm-hmm.
for her to stay. Any physiotherapy, if she wants to continue, she can continue it afterwards, whether at the hotel or not.
Mm-hmm.
But we did initially extend, I think, about 5-6 days after her discharge date.
Mm-hmm.
But we didn't need any of them. We stayed at home. But that option was there for us. But we had the 9-day, I think, all in all, like
Yes.
10 days.
10 days together, and I think
Mhm.
nice day after the surgery.
Yeah, exactly. So that day was adequate for us. There was no complications.
Mm-hmm.
But you do want to have that peace of mind. If you're going to come in here, it's not something you can just go and come back the next
Mhm.
day, because you really want to make sure you're looked after. So you want to have that option of staying a bit longer if you need it.
Mhm.
I don't see why you wouldn't. You're only going to do this once in a lifetime.
Yeah.
You might as well just make sure it's done properly. You don't want to have to come back for follow up after a couple of weeks because you didn't do the physiotherapies on time.
So in general, would you recommend like this kind of service for people who search for treatment abroad?
I want to do that kind of business myself. I think we want to set up. I think this kind of business should be set up everywhere, because it's not easy to go into another country, especially somewhere as, to me, not only Poland but Katowice. I've never even heard of Katowice before here. Krakow, maybe I've heard of it. Warsaw is is just to hear about it, but how it works, how the internal community, you have no idea how these things work. So you do need to have somebody sorting out, giving you all the information you need for the visa, for example. Talking to the hospital so they can give you the documents in terms of the payment. You need somebody that can do that for you. I don't think there's enough hours in a day for somebody who's never done this before to do this. You want somebody who's got all this information, who's done this before, who know what the requirement is, even preempt your thinking and give you more information. So absolutely, this service is absolutely amazing. And then Katowice, I want to talk about Katowice. I absolutely loved it. It was absolutely amazing. It was cool. I loved walking around the city. It was absolutely beautiful. You were kind enough to show me some of the spots and send me some links and where I can actually go and visit. And I did meet a couple of times, just kind of sort of see the area. So that was absolutely awesome. I don't know. If you told me you were gonna feel like this when we first decided to come to, town called Katowice, I would have never in a million years imagined I would have come out of it feeling comfortable. I would have been anxious about the system. I've never been there. It's too foreign for me. How are the people like? Am I gonna feel okay walking around the street? And am I gonna feel welcome? I've met people, really nice people. Made a few friends. I think I made friends for life here. I loved it. This was really cool. So the experience has been amazing.
Perfect. Thank you for the interview. I will turn it.
Pleasure.